Upon completion of your anterior procedure, take the anterior mouthpiece and discard it. Every single one of the Isolite mouthpieces are one-time use only. You'll need to remove the core anterior adapter to clean it between each patient. To do that, pull it off of the control head of your HVE. And now you have to separate the upper and lower portions of the adapter in order to clean inside. Take your thumb, open it, and then using the double-ended cleaning brush and a pH-neutral solution, clean the insides of the adapter to remove any debris or material that may have been collected during the procedure. Once that's done, place both upper and lower half into the autoclave bag and seal it. Please refer to the instructions for use for information about autoclaving the component. Once the adapter has been cleaned and put through the autoclave, to reuse it, it needs to be reassembled. Remove it from the autoclave bag and take the upper and lower portions and align them. Use the notch on the upper portion, insert it into the bottom half of the adapter, align it, and then click it closed. Once you've done that, now you can use the adapter by simply placing it back onto the HVE control head.